The $16 billion national health deal has been signed more than a year after it was first proposed. It'll deliver more than $100 billion in extra federal funding to the states over the next 20 years. Julia Gillard says it's the biggest reform since Medicare, but other health experts warn it'll do nothing but add another layer of bureaucracy in Canberra. To discuss what it means for WA, I was joined earlier by AMA Chief Dave Mountain and health expert Mike Daube, who used to run the state's health department. Welcome to you both.
Thank you.
Now, Julia Gillard has described this as the most significant reform since Medicare. Mike Daube, is it that significant?
Well, I think it's a step forward, and perhaps most important of all, it brings to an end this period of the Commonwealth and the states bashing each other. And, you know, what we used to have was every 5 years a huge conflict between the Commonwealth and the states over the Medicare agreement. There had to be a better way forward. There is now an agreement on the way forward. There is a bit more money, probably not enough, but a bit more money. There is a win for Western Australia because there's a recognition that we need to do things a bit differently, need to be treated differently. What I think we need to get away from, though, is this perception that there is some miraculous step that's suddenly going to reform the entire Australian health system, throw all the pieces up, and then they're going to land in some perfect kind of completed jigsaw. That was never going to happen. At least now we've got an end to the bickering and we can get on with improving what's already a really good health system.
And Dave, were some of those expectations heightened by the original deal that was put forward by Kevin Rudd?
Well, they were heightened, and I don't think that this deal is going to deliver very much of what was promised. I think Mike's been very charitable there about the bickering stopping. I can't see anything in this deal that's going to stop the bickering.
Why not?
Well, because there's no ongoing structure that stops the gaming that will happen between states and the federal government. They still are going to be divided funders. They will have every time there's a problem with the states delivering on a promise, they will go back to the feds and say it's because you haven't given me enough money. So I'm sure that's going to happen.
Where will the cost shifting occur then?
Well, it will still happen at the state and federal level. They'll say the federal government haven't calculated things correctly, or they've not given us enough money this year, or the arrangements aren't what they promised they would be. You know, when we look into it, I can guarantee there will be fights galore.
All right. So moving away from the bureaucratic element, what about what it means for an average West Australian when they go to a hospital? Will it improve that situation?
Well, there are some parts of it that are promising. The 4-hour rule that's going to be implemented nationally, if it works similarly to Western Australia, it does have the ability to actually change practices in hospitals. I think the 100% elective surgery target, to me, looks like pie in the sky. Most of the states are struggling to reach 80% at the moment.
So is it possible in this world where we've got an ageing population and more demand on healthcare, is there enough money to go around? Will there ever be enough money for a modern healthcare system?
Well, I don't think there is. I mean, there isn't enough money now. We clearly have delays to elective surgery. We have overcrowding in emergency departments. We have an inability to follow people into the community properly. And if we wanted to provide all those services, we would probably have to double the health budget. Nobody's promising that, and nobody is going to deliver that. But they keep on promising a Rolls Royce, knowing that they can only really deliver a Mini.
Now, to both of you, though, is there anything wrong with aspirations? I mean, if this is a key issue in everybody's life, healthcare, isn't it important for a federal government to try to take the lead on an issue like this, and and see a uniformity across Australia?
Well, what the federal government needs to do, and what it's trying to do, I think, is to bring all the jurisdictions together to get some agreement on process, some agreement on targets. I think it's a good thing that they've stepped back from that very, very lofty rhetoric that we're hearing for quite a while from Kevin Rudd, that essentially all the world's problems in health were going to be solved and there was going to be peace in Afghanistan too. You know, that was never going to happen around the health system.
What's the missing element? What would make it better, and what would actually improve healthcare outcomes?
Well, there was a lot of talk about involving clinicians, making sure that the people on the ground were involved in designing the system properly, and yet all the things that have been put in place, in fact, have increased the bureaucracies at central level. We've got Medicare locals, which are actually going to be more remote than the current divisions, and less involvement of GPs in managing the primary healthcare needs of our population. And then we've got a whole new bureaucracy in Canberra. There's 3 or 4 new bureaucracies all being set up. So, and no promise that the local clinicians in the local hospital networks will be involved in making decisions as well.
So would it be fair to sum up what you're saying is that the system is as riddled by politics and bureaucracy as it's ever been?
Yes, and there's nothing in this that's actually going to take it backwards. In fact, we're going to set up new bureaucracies for primary care on top of the bureaucracies we already have for state health departments.
Okay, last word to you, Mike. Is something in there, what's the missing element that you were keen to see in this project?
Well, the missing element is always going to be more money. So at the end of the day, if you want more beds, if you want more services, then you're always going to need more money, and that's just inescapable. And that's the issue that will, I think, in a sense, bedevil health for the foreseeable future. But I'm just a bit more optimistic than David, because I think we've got the framework to work off, and I don't think it's a bad thing, actually, to have a few bureaucrats making sure that it does work.
Okay, thanks to both of you.
Thank you very much.